Hi there, listeners. Welcome to the new episode of The Whole Box. I said I'd be back. I said I'd be back this year, and this is something that I've had in the back burner for a little while. Actually had a little plan to try and do it last winter, but here we are, 2024. And the subject matter that we're going to talk about is, well, in simple terms, it's joint injections. But really, it's sort of having a look at that, a little bit of the culture of keeping competition horses on the road, particularly in the eventing world, but also just about what that is, what that means, what we can do. A lot of the modern treatments out there, they're out there and available now. And I have got an old friend back on, absolute fan of eventing, absolute legend, been to God knows how many championships and Olympics and 5 stars around the world. Chris Elliott, who joins us from sunny Wellington. How are you, Chris?
Good, thanks, Spike. Yes, it is sunny. I'm just looking at it. Yes, it is still sunny. I confirm that it is Florida. It is sunny. It is warm. It is tropical. It is lovely.
How's life treating you? Yeah, how's life treating you out there? You're working for a big practice in Florida, treating lots of horses.
Yeah, based here in Wellington in a big veterinary practice, Palm Beach Equine Clinic. We got 30 sport horse veterinarians doing all things in terms of hospital and on the road. I'm based on the road, ambulatory sports medicine and rehabilitation. Having a great time. We're here in the middle of our winter equestrian festival. So 12 straight weeks of elite level show jumping and dressage. It's hectic. Horses everywhere you look, and certainly lots of joint injections everywhere you look.
Yes. Yeah, we'll get onto that. We'll get onto that about the sort of slightly different approaches you get as in different jurisdictions, different countries, and things like that. But thank you for joining. Really excited about doing this. And listeners, if you've got any questions as a result of it, please get in touch. I think it'll feel a little bit like we're just sort of scratching the surface on the topic at times, but we'll try and dig deep. We'll try and pull out some interesting info for people. Hopefully just get a few people thinking about sometimes maybe a slightly different approach to things. So, Chris, I really simply wanted to talk, I've titled this Joint Injections, but I suppose the first thing we probably need to explain to people and what we can talk about is what we would see as what we call joint disease as such. So what are we treating as a starting point? Are we, so let's say we're talking about a horse that goes lame. First off, how's the vet going to work out that it is a particular joint that the problem is? But after that, we'll go on to sort of what that then means.
So in when we're thinking about joint disease and we're thinking about orthopedic causes of lameness, first of all, your veterinarian, like us, we're going to do a comprehensive, thorough lameness examination or orthopedic examination, or potentially thinking about that maybe as a performance examination. So, we have joint disease as a cause of lameness all the way as a continuum from significant joint disease causing obvious and overt lameness, all the way down to potentially mild and moderate joint disease that is causing potentially poor performance. So trying to narrow down our location involves palpation, examination in hand, sometimes examination under saddle, and then things like flexion tests, discussing with our riders what type of issues we've been seeing. And then if we're seeing an overt lameness, utilizing our diagnostic analgesia, so nerve blocks, to try and localize exactly where our pain is, and then trying to bring that down a little bit closer into what area of the leg, particularly what joint we might be talking about, and then thinking about our diagnostic imaging, x-rays, ultrasounds, and maybe some more advanced diagnostic imaging to work out we've got a joint. There's lots of parts to that joint, soft tissue as well as bone. We've got soft tissue around joints. We've got soft tissue within that synovium, the joint capsule. Then we've got the bone. We've got the subchondral bone. That's the bone directly below the cartilage. That's really important to think about. And then we've got the cartilage. And then we've got the synovial fluid, and all of those things are all involved in what we call joint disease. Sometimes nice to think about it as degenerative joint disease, DJD. As all of us are aware, as we get older, our joints become more sore, same as our equine athletes. And some of them are chronic, repetitive strain type injury. Some of them are a more acute injury on top of a chronic process. But the complexity of joint disease is there from a multitude of different levels and different severity.
Yeah, you definitely touched on it there a little bit about, finding as close or if, hopefully a very exact diagnosis being so important. The use of ultrasound, X-ray, things like MRI or CT scanning can be useful as well. Yes, it's a more expensive approach, but it can very much lead to, what we're going to go on and talk to you about later, about a very much a targeted approach to what we're trying to achieve with any treatments or any injections that we're talking about here. So yeah, I would, my real approach there would be, trying to get an exact diagnosis, A, what is joint affected, and then B, what do we think is actually going on in that joint as best we can. Because actually there's some cases, for example, you can get bone chips in joints. They can be developmental in young horses, where actually joint injections are probably not the way forward. These become cases where keyhole surgery is the way forward, and referral for surgery. So that working out what we're talking about as joint disease and what's causing the disease and what the problem actually is,
I think
is always the first step, isn't it?
I think for riders and owners and clients of us as veterinarians, the money that is spent in accurate and correct diagnosis is always going to be good investment. It's better to spend our money in accurate investigations and accurate diagnosis as opposed to spending our money on treatments that are not targeted.
Yeah, very much so. But you can have a stepwise approach, can't you, Chris?
Absolutely.
We were just mentioning there, sometimes an obviously lame horse that you can do those diagnostic approach to with the nerve blocking or the joint blocking, the low grade performance limitation that you can sometimes have. They can be really tricky things, and actually going down the line of as a treatment option to see what the response to treatment is actually quite a common approach to the sports horse, isn't it?
And that's where the experienced veterinarian within the sport understands common things happen commonly. Balance of probabilities. It's likely that this is our location of our cause of our performance limitation, our soreness, our lameness. So let's do our, educated treatment option. Let's see how this horse responds to that. If our horse responds well to it, great. If our horse doesn't fully respond to that, then sometimes going down that diagnostic pathway can be really helpful. But you're absolutely right. Sometimes the concept of the trial treatment can be really quite nice, particularly when we understand what the horse is doing, where it's in its education and training, and kind of what our goals are in the short and long term for this horse. Common things happen commonly.
Yeah, and it's funny, I think back to when I was a vet student, and we kind of got told that you weren't allowed to sort of pattern recognize, you had to have this very systemic approach to problems.
Pattern recognition.
Whereas I now find myself doing a lot of pattern recognition. It probably means I'm old and I've seen a lot of patterns, I suppose.
Yeah,
but that is difficult, isn't it? As you say, with time and experience, you can develop your understanding of, what common things are common, but how do they present? And that can be a sensible approach. But equally, there isn't anything wrong with going, I actually want to have a systemic approach to this, and systematic approach, sorry. Different ways of approaching it. And I think that performance management stuff. Now, we've spoken about this in the past, and dig out some of the older whole box stuff that we did with, I think we did a physio one and a farrier one and things like that. But when we're talking about performance management, Chris, and let's try and stick to probably our eventers, what if I said we're performance managing event horses, what does that sort of mean to you as a sort of a bit of a summary?
So for me, I feel like it's creating that solid relationship between the whole support team, the rider, the groom, the veterinarian, and our other complementary therapists, physios, farriers, so that we all understand this horse intimately. We know how it moves. We know what's normal for this horse and maybe what's slightly off. Performance management is in setting goals, what we're trying to achieve, where we're trying to get to, because we as veterinarians need to understand what you're trying to get to, what your short-term goals and what your long-term goals are, because if we sacrifice a long-term goal to achieve a short-term goal, sometimes that's less than ideal. But performance management knows what the horse is currently doing, what it wants to do, and where we're all trying to get to. But that close relationship between the veterinarian and the rider and the groom and the horse, knowing exactly how that horse moves and regularly monitoring it before and after competitions, beginning of the season, middle of the season, and end of season, is how I think about performance management. And then optimizing performance, knowing sometimes the small ailments that are in these horses, how best to support them through its athletic career. These horses all have little things that aren't quite perfect because they're elite level athletes and they're doing their job. We got to support them and make sure that they continue doing their job.
It's amazing how and also we can't forget that these are horses. These are an animal, and they all vary with their approach and how they do they want to how they want to be trained and how much they want to do it. And one of the things that's sort of a bit of a when you speak to we speak to our 5-star riders and we talk about their 5-star horses, but I mean ultimately the horses that are getting to that level of competition are just so brave and have probably a pretty high level of managing. I hate to use the word pain because that's really anthropomorphizing it, but they training is they can get sore. Look at elite athletes in football or rugby or whatever sport we're looking at, and you can find sometimes you can be looking. You have these cases where, can't you, Chris? You look for ages to find that subtle little niggle or whatever it is, and you've got a horse presenting just not wanting to do it. It's rearing, or it's doing this, or it's doing that, planting, just doesn't want to do the job. Yeah. And then you get asked to go and look at a horse that's been performing at a high level, and the rider goes, "Oh, it's always been a bit like that," and you're like, "Well, it's a bit lame. Like,
it's really lame.
How's it?" And it's been doing it for however long, and they just. And that's that natural variation, and that's why I think as vets we always need to be really respectful of the horse and respectful of what they're able to do, but also that natural variation in the clinical presentation of the cases. So I think that was a really good summary, Chris, of what that performance management. I do look at it a little bit as well as looking at sort of injury prevention as well. I think you've got those horses, and we all know them, that roll just drag themselves along in front, loading their front end.
If they're uncomfortable behind, they overload in front, and then when they overload in front, they're going to be causing themselves an injury in front. So you actually need to prevent the injury in front by making sure their rear end is as perfectly comfortable as possible. And the thing that connects the rear to the front is their back and their SI, and their neck.
It's remembering that there's a horse attached to whatever single problem there is. So we've talked about this before on other podcast. Guys, go out and dig them out. The one I think I did with Emma Dainty, the physio, was very good, and we talked about that sort of whole horse approach to problems. Right, Chris, joints. Let's get back on the subject. Me and you could just banter around about all that stuff for ages. So we talked a little bit about those different presentations, and they vary from a horse that's going acutely lame, as we call it, or a horse that's got a chronic problem, which means it's been going on for a longer period of time. But you've touched on it a little bit, but what are we looking to achieve from our treatments? What's the aim of the game?
So our joint disease, whatever our cause, the fundamental reason why the horse is painful in my mind is because we have inflammation. We have an inflamed joint on its most simplest thought process. We have inflammation. Inflammation causes pain. Now, inflammation is also causing increased synovial fluid, the puffy joint. That's painful when we have a fusion there. We have inflammatory proteins, inflammatory markers within that joint that are creating pain. And so our fundamental overriding principle is to control inflammation. When we control inflammation, we control pain. When we control pain, we then return the horse from being asymmetrical and lame to being less asymmetrical and hopefully sound in terms of free of pain. But fundamentally, it's about controlling inflammation.
Okay. And so that's looking at it as managing the inflammation and managing the pain. What about the other side of what we might be doing with our joint medications? We can take away the pain, and we'll talk about the various ways we can do that. But what about altering what's happening within that joint? So let's say with our advanced diagnostics or good X-rays, good scans, we've diagnosed, let's say, a soft tissue problem. Let's say the joint capsule, as you say, which has got the synovium, has been a bit injured. Rather than just managing pain and inflammation, what else are we going to be achieving from from our treatment here?
So trying to use our joint medications to be promoting a healing process. So we can try and promote that healing process by promoting an anabolic process as opposed to a catabolic process, so a building process as opposed to a degrading process. So using our joint medications and our joint therapies to be promoting a healing reparative process, and then potentially trying to modify the way this joint is going in terms of, instead of it being a negative cycle, continued exercise, creating more degradation, we're going to try and reverse that cycle to try and promote a healing and building process.
And that links back to what you were saying before about getting a really important history and background on the horse and the clients about what the sort of short-term and long-term goals are, as well as the age and level that the horse is competing at. So I think you said already, you don't want to be damaging long-term goals by achieving something in the short term. And I think that's that real balance between what we're discussing there, between simply taking away the pain and having a horse back in training, as it were, versus what we're trying to achieve about modifying whatever disease process there is there, which is always going to take time. However fancy we are with our with our treatment and rehabilitation processes, time is always something that we want to be giving horses to heal, in inverted commas. So yeah, I think that's a really important thing. If you've got a horse, and again, it depends on the plan. We might be a horse might have sprained a fetlock 3 weeks before going to the Olympics. Well, the most important thing of the year is to get this horse as comfortable as possible so it can go and compete at the Olympics, versus your 5 or 6 year old that's damaged a bit of cartilage and you want to do the best thing for it in the long term. So yeah, listeners, I think that's always a really important aspect to what you're trying to achieve with these.
Performance management, understanding our short and long term, and creating that team between the rider and the horse and the veterinarian.
Yeah, very much so. Okay, grand job. So right, let's talk about some of our treatment options. I suppose it might be quite handy if we had an example joint or something, shall we? So let's say, no, maybe we won't talk about an example joint yet. Let's talk about the different treatment options, Chris. We can talk about, the title of this is we're doing joint injections, but are there any other things that we can do to treat joints without having to stick a needle in it?
So yeah, I think we have our systemic medication, so medication that we're giving the whole horse, and that can probably be broken down into our anti-inflammatory medications, whether they, and they're typically thought of as our veterinary medicines, like phenylbutazone, meloxicam, our non-steroidal anti-inflammatories that are using to control our inflammation on a whole body. And then we have potentially our other whole body systemic medications, things that are more targeted at supporting our joints, so potentially injectable systemic medications like Pentasan or hyaluronic acid that you're giving to the horse as a whole horse type treatment.
So sorry to jump in there. Yep. So listeners, we talk about different brands there. So Pentasan it's an Australian, New Zealand brand, isn't it? Pentasan, Pentasan Gold. Listeners, you might, Cartrophen would be a common one.
Yes.
Adequan was one that was available. I think that's less available now. Arthropen is another one that's come to prominence over here. They're all very similar. They're all pretty much the similar active ingredient. They might just be in slightly different concentrations, depending how much bang you get for your buck, as it were. And Chris talking about hyalinate, again, the hyaluronic acid, there's various versions of that that can be used as well, depending on which country you're in. So what do you have over in? I bet it's all very popular in Wellington, all those things.
Yeah, absolutely. So the FDA approved version of Pentasan polysulfate, which is your active ingredient, is called Zycosan here in the US. And then hyaluronic acid, a very typical one, a brand name is called Legend. And then Adequan is your number one kind of systemic joint support medication. And then we have plenty of oral type supplements, plenty of them quite natural.
Plenty of them around.
Plenty of them around. But in terms of looking at the evidence that supports a lot of these oral medications, at times the evidence is really lacking to support their use. And I think in general, if we make a very broad summary of our oral joint support medications, we've gone away from the concept in medicine, human medicine, as well as veterinary medicine, of providing more building blocks to joint health, as in, it's degrading these ingredients. You need to just give more of those ingredients to your horse or your human. It doesn't quite work like that as we once thought. The general principles of our oral supplements or our nutraceuticals is about providing some form of natural anti-inflammatory, natural antioxidant, natural kind of often plant-based ingredients that are providing a whole body type way to control those inflammatory markers that are there, that are contributing to our degradation of the joint.
I think we all need to be very cynical. I'm an old man, so cynical. I think
cynical's real. I think we should all be cynical.
I think we should just be aware of how much, the cost of some of them, and with limited evidence. But
correct. So huge costs, limited evidence, very limited evidence in many ways. I know here with my clients, I actually have a little thing on my phone, and I break down like the yearly costs of all of these supplements sometimes, and I just compare and contrast it for my clients to say, hey, look, that's super that you're giving that product, but you do know you're spending like $3,000 or $4,000 or $5,000 a year on that, when actually we could just be spending that maybe a little better on management, farriery, proactive veterinary interventions, that type of thing. I
always think with horses, it's always a really bad idea to extrapolate to what it costs you for a year. It's just a number you never want to know, isn't it?
I know, but sometimes it's very easy to spend clients' money on things that have limited evidence.
Yeah. And I think that, and what we can say is that the medications we talked about, the Pentasan, the polysulfated glycosaminoglycan, so that's the Cartrophen and the Pentasan and whatever the different versions are, they do have published evidence and that they have an effect. They are by definition a medication, so they have to prove an effect, otherwise they aren't allowed to be medications.
Correct. And evidence to show disease modification, not just symptom modifications. That's a nice little kind of concept that we'll probably talk a little bit more about when we talk about this other stuff. Symptom modification is taking away the inflammation, taking away the pain, making the horse look better. Disease modification is that a lot of these products that veterinarians use have somewhere along their research and development, and then peer-reviewed, published protocols that show that they do actually modify the disease process. They slow down the degradation of cartilage. They reduce the amount of fibrillation or kind of fraying of cartilage edges or bone. They show some increases in improvements of radiographic changes compared to placebos. A lot of these medications that we have talked about and will talk about do have proper science behind them. And so I think clients should be willing and open-minded to discuss these things with their veterinarian about what has evidence and what has limited evidence.
Yeah, no, I think that's a really good point. And I think the final thing I would say is when we're talking about efficacy here, I think that these things have a place. They're supportive.
Mm-hmm.
I think they're probably not so powerful to turn a horse that's showing signs of lameness into signs of soundness. But I think from the point of view of trying to support cartilage, it's very very effective at doing that. And yeah, we can. The nice thing is actually we can give horses under FEI regulations. They can have a treatment of carchafen or hyaluronic acid during a competition. There's certain regulations about the timing of that, but generally speaking, post cross country or the night before cross country can be a really nice time to ensure we are supporting that horse's cartilage when they're going out and doing their galloping. So,
and in terms of these systemic products, having that consultation with your veterinarian, how to use them wisely and how to use them in a targeted fashion, not just giving them whenever, trying to utilize these medications when they are likely to be more effective and when they are likely to give you that performance management benefit.
Yeah, no, I'm totally on board with all of those things. So let's talk about the treatment options that can go into joints then. And I'm going to quiz you, Chris, because you are my guest and I'm the boss. And I'm also going to just be there's some various old wives' tales and there's various I'm going to be.
There's lots of them.
I'm going to sit on the fence. I'm not. I'm going to sit on the other side of the fence and I'm going to quiz you about the things that I think as all vets, we all get challenged with day to day about certain things. So let's start off with, let's say we are simple terms. Something that's very commonly done is, let's say, medication of the lower hock joints.
Yeah.
What are you going to do to treat my horse that's got mild signs of lower hock joint arthritis?
Yeah. So hocks are your number one kind of place that we're injecting products into, particularly in our performance horse. So for me, my first point of call and the cornerstone of my orthopedic practice is corticosteroids. Triamcinolone or betamethasone at an appropriate dose inside those joints as a potent corticosteroid anti-inflammatory with some evidence to say that it has, at least to a certain degree, some disease-modifying effects. So putting steroids inside the hock.
Dr. Chris, my livery yard owner, tells me that once you've started treating horses' hocks, the effect wears off really quickly. So I don't want to start doing it now. I want to wait.
Okay, so that concept is very commonly held, and I would like to challenge that concept by saying that as all athletic horses continue through their career and as all athletic horses age, their joints continue to degrade as they get older and as they progress through their athletic career. All joints degrade over a period of time. Now, at what point do they start becoming clinically apparent, and at what speed do they start degrading to a point? That's all individually variable. But the concept of once you start injecting a joint, you have to keep injecting and you're going to have to inject it more frequently is not, in my mind, anything to do with the fact that you've injected it. It's the fact that you've continued to compete the horse. The horse has continued to become older. We can't reverse time. And for some horses, you need to get you need to inject that joint to get them through the hurdle of that area being painful, but we can then actually do lots of things to the whole horse to potentially prevent having to inject that again, because maybe the reason why it's sore in one place is because actually it's sore in many other places, and we can get them under control as well. But my take on the concept of once you inject it, you have to keep injecting it, and it gets more frequently as you go on. It's got nothing to do with the fact that you're injecting it. It's just the fact that the horse is continuing in their athletic career, and the horse is continuing to become older, and all joints degrade over time.
I have to say, invariably, my answer to that is usually I'm being asked to come back and treat it again because it did a really nice job, and then it starts to wear off, or the disease gets a bit worse again, and they want me to come back and make it go better again.
Yeah.
So
that's the simple
it's
answer.
Sort of a simple self-fulfilling prophecy.
Yeah.
Right, Dr. Chris.
Yes.
My friend read on Facebook about a friend's horse that got laminitis after it had steroid injections. Does that mean my horse will?
Yeah. So whenever we are injecting a joint as veterinarians, we always have the potential of complications. Everything that you do in medicine has the potential of complications.
No, there's no such thing as complications. Everything has to be fine and rosy.
Complications are real. We do everything that we can in our power to minimize those complications. So steroids in horses that are prone to laminitis have the potential of triggering a laminitic episode. And that's steroids in any fashion, whether it be inhaled steroids, injectable in the muscle, in the vein, or into the joint, any type of steroid. Now, in terms of the evidence to show that it's associated with the induction of laminitic episodes, the evidence shows that in horses that are prone to having a laminitic episode, and those horses are the horses that are metabolically unstable. For example, they are metabolically Cushingoid or have equine metabolic syndrome. In those horses, if we use a dose of steroid that is too large for that horse to cope with, then we can potentially induce a laminitic episode. So steroids plus horses that are already at risk factor for laminitis, as in they're metabolically unstable, has the potential of triggering a laminitic episode if we don't use an appropriate dose of steroids.
Good answer. I was being a bit facetious at the beginning, but it is always a good question.
It's a great question.
It is a good question, and I actually love it when my clients question me. It's quite fun.
No, but it's real.
There's no such thing as a silly question, and
it does sadly occasionally happen. But in horses, in a veterinary client relationship that can identify potential risk factors, we can either modify the doses of our steroids, or we can use alternates to steroids. Still, the cornerstone of my practice is steroids inside joints, but there are nice alternates which are particularly suitable for those horses that are at risk of inducing a laminitic episode.
I've had cases of it. I'll be the same as you, Chris. It's the cornerstone of what I do. But sadly, you do see the cases, and you still get the odd one. You do get the rare one that surprises you. I sadly lost a really lovely event horse at one point, and that was fit, and it was in work, and the only thing I could put it to was, and it is something, and then this is a personal thing, listeners, but I'm quite wary of having horses shod on the day I medicate their joints. I have a couple of cases I've seen of it is sometimes when either there's been a little, the feet can get a bit, some horses get a little bit pulsy after they've had been shod, particularly if they're hot shod. And I think the two of the less than 5 cases I've seen of laminitis post joint injections, I think have been related to, and it's in no way the farrier's fault. They've not done anything wrong. It's just a couple of risk factors happening at the same time has just turned into a problem.
I try and give a couple of days either side.
No, I would be the same.
Don't be injecting joints within a couple of days of the farrow being coming, or don't inject, before or after. I definitely do that as well. So that my standard setup as well.
Yeah. Okay, cool. Well, I mean, and then the other risk factor, and it's probably equivalent to all joint injections, is infection.
Sepsis.
So right.
Absolutely.
So everyone, you'll see the vets will do lots of scrubbing. Some will clip the hair off, although that is a little bit controversial. There's actually not, to my knowledge, Chris, you're the absolute expert on published papers, but there's not any sort of definitive evidence to say that clipping reduces the risk, unless you've got a horse that's particularly hairy, and some do have particularly hairy legs at this time of year.
Clipping has been shown to not decrease the risk. There is no change. Again, controversially, there was one paper to say that it may even increase the risk, but the best summary is to say that clipping or not clipping, it is the same potential risk for sepsis. There's also some nice evidence out there in the papers that say that our potential risk for a joint infection is no different whether it's done inside a hospital or on the road, ambulatory. There's no difference whether it's done by a hospital clinician or an ambulatory clinician. Both you and I live our lives on the road, but we've also spent times in the hospital. I do have a couple of setups where we walk the horse from one barn to a different barn just a little bit down the road because it's just a more clean setup. But there's no difference in terms of our risk factors for joint infection, and cleanliness, sterile prep, scrubbing. For owners and riders and clients, watch the veterinarian when they're drawing up all these things. You'll see that we are amazingly particular, even on like the very particular way we open our syringes and our needles, and the perfect way we put our gloves on, like being like really cautious. And I certainly have interns that ride around with me, and they're always commenting how many times I'm changing my gloves, because gloves are cheap, and I'm more than happy to scrub a bit and change some gloves and be super clean.
You won't have any of this in Florida, but there's a thing over here at the moment called mud.
Yeah.
And there is nothing more annoying to a vet arriving to do some medications and to find mud plastered all over legs.
Yeah.
I know. There we are,
dust.
guys. Yeah, you have dust instead, do you? Yeah, we have mud.
We have dust. We have dust
cold.
And wind. Wind, and all of a sudden, like something blows past your nice sterile field, and then you lose.
Oh yeah, that is annoying. The wind is annoying as well. You're right. That is quite annoying.
But yes, cleanliness, it is a potential risk. Laminitis, it is a potential risk. It's important to understand that these are very, 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 very unlikely, but not impossible. And in the hands of a conscientious veterinarian, something that we keep in our mind, and we do everything we can to minimize even further.
Right. Let's move on to some of the cool things that we can now put in horses' joints. So cortisone is the cornerstone, because we like it because it is cheap. Cortisone
and it works.
It's cheap and it works, and it's very effective at reducing pain and inflammation. So therefore we like that.
Yeah.
But there are other things that can do it too. And I wanted to just split these into two different categories. So we can have, so these come under the heading of what we call biologics. That's the term that we as vets call them. So this is where we generally, apart from the exceptions, taking blood from the horse and then doing something to it. And then what we get at the end of it, we're putting into the joint. And we can actually split these into two different areas, where we can have the anti-inflammatory ones. So we're looking at trying to do the similar job to what cortisone is doing. And then also we've got ones that are sort of even more disease modifying. So sort of more for sort of healing and rehabilitation really as well. So do you want to crack on, Chris, with a couple of the anti-inflammatory ones?
So in terms of our biologic IRAP, an oldie but a goodie, something that's been around since we were in veterinary school, still something that I use a lot. So IRAP stands for interleukin-1 receptor antagonist protein. So basically, all of these blood derived products are trying to concentrate the body's own natural anti-inflammatories and its own natural growth promotants and their own natural biologic healing mechanisms. So IRAP is an oldie but a goodie. It's probably, in terms of its fancy concept, autologous conditioned serum. So the serum in the blood, we pull it from the horse and then we process it. The difference about IRAP compared to what most of the other biologics that are a little bit newer is that we incubate it overnight. We pull it in a fancy syringe which has these little beads in it, and then we heat it up and incubate it overnight, and we really grow the goodness that's in the blood already, trying to multiply it, and then we concentrate it down, and then we put it back into the horse. And so the downsides of IRAP is that you've got to have that ability to sterilely incubate it and process it, and it's not an instant gratification process. It's a pull the blood, take the blood away from the horse, process it at your facility, bring it back to the horse, inject it. But the good thing about it is that it is you get quite a large volume, and so that means that you could potentially do a couple of joints or several joints in one go, or have multiple doses over a period of time. Because the cool thing about these biologics is that once we've pulled it and we've processed it and it's sterile, we can freeze it, and then we can use it later. And actually, some of these biologics are even better when they're frozen. We've been shown that when you freeze the biologic, it actually releases more of the goodness.
So
do you use IRAP?
I don't. I use a different version of IRAP. So IRAP is, as Chris has talked about there, focuses on one particular anti-inflammatory protein. I do my version of the autologous conditioned serum is a product called ProStride. So similar thing. We pull the blood, we stick it in a centrifuge. So we spin it, do it a couple of times. So first thing we do is we make another product called PRP, which we'll talk about, platelet-rich plasma, and then we transfer that into another little plastic well, and then that's got some beads in as well, and then you give that another spin, and then you end up with a little bit more of a soup of anti-inflammatories rather than just the one that IRAP focuses on, which I quite like, because I think sometimes we can just be over focused on one particular protein that we might have focused our interest on. And also it's quite handy because I don't have to incubate it for 24 hours. I can do it there, stable side. I can make it up and I can use it and treat it. I suppose the downside of ProStride is you only end up with about 3 to 4 mil.
So ProStride is the brand name, but basically your first process is you make platelet-rich plasma, and then you concentrate it down, and essentially you get the best of ProStride. The ProStride is almost like the best of PRP with a lot of what's really great about IRAP. And the cool thing about IRAP is it's got excellent studies and excellent science. Even more cool about ProStride is it's got great science and great studies, which shows that you don't need to take it back to the hospital. You can just do it stall side, which is really helpful for an ambulatory practitioner, and then owners and riders that aren't localized near near big facilities. It's got good evidence, nice published papers to show ProStride does have efficacy. It has lots of different types of growth promoting, growth factors, anti-inflammatory proteins in there. It's a really nice product, and it's certainly something that I put some ProStride in a horse yesterday. It's a nice thing.
Good product. It is more expensive than cortisone. I think we said one of the advantages of cortisone is the cost. It is probably 10 times more expensive per vial of what you're doing, but and that might vary, but it is a good product. It has the advantage that it is not cortisone, so you don't have to worry about the laminitis concern. So you don't have that yet. You're still getting the nice anti-inflammatory effect You tell me, Chris, you would be the expert on it, but whether it's considered equal in its efficacy of anti-inflammatory versus cortisone, probably not.
No.
Yeah, probably not. But
I think in
still
terms of,
good.
but the thing is that you can use too much steroids. Yeah. You can't use too much biologics, and potentially each and every time you are using your biologic, you're maybe creating a inverted commas slightly more healthy joint. Maybe you're certainly putting growth factors in there. You're certainly putting things that in a petri dish have been shown to be more anabolic as opposed to catabolic, so building as opposed to breakdown products. And so maybe when you're using it over a period of time, you might be having more of a disease modifying effect, and potentially more slowing of the progression of the disease.
Cool. Yeah, good product. I enjoy it. It's great that as an ambulatory vet, that it's something that we can do out on the road.
Yes. Similar to PRP.
Similar to PRP, which we will get onto. We've got one more anti-inflammatory biologic that I think we should talk about. That's become definitely in the UK more prevalent in the last couple of years. I think it's probably been in America a little bit longer. But that's a product called Alpha 2 EQ. Are you using a lot of Alpha 2 over in Wellington, Chris?
Me personally, no. American vets, yes.
And what's the principle behind this product?
So I think it's good to take a small little step back and say that all of these inflammatory proteins and all of these markers and all of these growth promotants are present in all horses' bloods. And the way you process them to try and increase one over the other is what sets the different products apart. However, there is currently no direct comparison between one product and the next product and the next product and the next product to truly say, well, this product's way better than this one in terms of these markers. No one's ever done that study, and I don't think anyone's going to ever be able to do that study because it's just almost impossible. You're comparing apples with oranges, with pineapples, with tomatoes. They're different, and they're approaching the joint health in a different way. Then also, another thing, just to put a slight caveat on all this to confuse everyone, is that when you are trying to bring a product to market, you have to try and prove what you can prove. And you have to go out there and prove to the licensing bodies that this product does this. Now, it's impossible to go out and prove that it does 15 different things. So what you'll do is you'll go and prove that it does something slightly different than everyone else's. So there is IRAP inside ProStride. There are the growth factors in ProStride inside IRAP. There's Alpha 2 inside ProStride. All of these different factors are in all of the different products. They just potentially have slightly different proportions. And so that's my little caveat to say that none of them have been proven to be better than anyone else's. They all have their pros and cons. This particular product that Spike is talking about, Alpha 2 macroglobulin, this is a cool little protein that these guys essentially discovered that can bind on to what we call proteases and MMPs, metalloproteinases, and they're the little bad guys running around inside your joint, chewing up all the goodness. And so what they can do is essentially capture them and get rid of them and bind them up and stop them from doing badness inside the joint. Alpha 2 inhibits that cartilage degradation. And in terms of the pros and cons of it, Alpha 2 gives you a large volume for what you get. So Spike spoke about the ProStride giving you a smaller volume of something. This gives you a much larger volume, and that can have its efficacy because then you can have one spin of this blood and get a large volume of something to then use it potentially either many times because you're freezing it, or using it in multiple sites with requirements for larger volumes.
Yeah.
So
I've been pleased with it, Chris. In my experience.
Oh no, in our practice, it's one of the most popular choices.
It's a good product. I suppose what I would say, we're talking about, big picture here, guys, just comparing it different things. I think it definitely doesn't quite act like the switch that cortisone often is, that you put the cortisone in the joint and the anti-inflammatories cracked on and kicked on very quickly. I think there's a little bit more of a delay in my experience. It can take, and feedback from riders, it can take sort of a week, if not 2 weeks, to really see an improvement, but that's fine. That's not a problem. And I've actually had some nice effects using it. I know we're talking about joint injections here, but I've been using it treating back pain as well.
Absolutely. The biologics
had a really nice effects from that. So
biologics in that axial skeleton, within that neck, within that back, and within that sacroiliac definitely is a place to be that we could be utilizing them. And so alpha 2 gives you a large volume, because sometimes we have to use large volumes in large bits of the body in terms of the back and the SI.
So there we are, guys. These are these new cool products. There are people out there always trying to do that, researching this on an absolutely, less than microscopic, on an absolutely cellular level, about working out what proteins, what anti-inflammatory things we're using. So there's always new products coming out. When you're talking to your vet about joint injections, they'll have plenty in their armory from that point of view. So there's a few anti-inflammatories. There's the final sort of biologic I was going to talk about, and we've already touched on it, is PRP. Actually, no, we might do it. Well, another one that we take from blood from spinning it anyway is PRP, where the principle there, which is platelet-rich plasma, is probably more using it for the sort of healing and growth factor side of it, rather than more of a specific anti-inflammatory. It does have an anti-inflammatory effect. There's no doubt about that. We know that. But personally, I would be using that in joints where I'm then giving the period of time of rest and rehabilitation for the horse to try and heal a problem, whether that be a ligament that's attaching into the joint, whether that be because of the joint capsule having a problem, and those sort of things. So that's another option. PRP will be used quite commonly in tendon injuries and other ligament injuries, into lesions, but you can put it into joints, because again, there's a cavity there that you can inject into. Stifles, for example, there's quite a lot of soft tissue injuries in stifles, and it can be quite effective there. So PRP, platelet-rich plasma, is another tool in our armory of take some blood and spin it and see what you've got.
It's something that I use inside joints as well, so I think that's good. Using much stem cells inside joints, Spike?
I am not personally, but that is something we were going to go on to. That is an option. The product over here is called Articell. It's for vets to handle. It's quite, because it's got to come frozen. It's a stem cell derived product. It's been from stem cells of another horse, which is pretty cool science, isn't it? That you're taking stem cells from another horse and you're doing something to it. What they're doing is that they're sort of persuading these stem cells to become cartilage, or influence cartilage, or do something to the cartilage rather than just do something else. And then they're freezing them, and then we're then putting them into joints. And there's some nice papers and some nice evidence that it does do something.
I think the caveat on all things stem cells, having put some in joints and having done a whole study in my residency about putting them inside tendons, is that stem cells aren't magic. They don't just magically grow into brand new things. You can't just magically put them inside a joint and assume that you're going to grow a new joint. They are potent anti-inflammatories. They're what we nerds call chemotactic. They are cell signaling, as in they tell the rest of the body, hey, dudes, this is an area of badness. Come and heal it. So they bring healing to an area, but they don't magically just grow back things.
It's funny, isn't it? We would always imagine stem cells, putting stem cells into something, they are going to then be turn into what we want them to be.
We wish it was.
Yeah, we know that that's not the case.
No,
even in tendons, we know that.
Stem cells have their place, and we're learning more and more about them. But they are not magic. None of these biologics are magic. No joint injection is magic. It all takes time and rehab. But yeah, the stem cells are an interesting one. That RD-cell product is trying to get licensed here in the US, hasn't quite reached us here yet. Came out of Germany and then the United Kingdom, and then trying to get licensed here at the moment.
And then my final product I was going to talk about, and I think it's licensed over there with you guys as well, is a product called Arthramid. That's the trade name over here, but that's what it is. It's called polyacrylamide gel. So basically, it's a sort of a liquid plastic that became licensed, I think, would say in the last 5 years, for injecting into joints, and the effect that can have. Do you want to? You're very good with the science, Chris. Do you want to explain what the theory is behind using the gel?
Yeah. So Arthramid brand name. Another brand name is Noltrex. Another brand name that's popped up here in the US is called Sprung. So a polyacrylamide gel. Essentially, think of it as almost like a plastic filler.
It is.
Came from our cosmetic medicine friends.
Sort out my crow's feet.
Yeah. So the thought process is that this polyacrylamide gel goes inside the joint and it coats either the surface of the cartilage or the surface of the synovial lining, and then in that process dulls down that inflammatory synovitis, those inflammatory processes, reverses some of the damage that's happening inside the soft tissue inside the joints, and then potentially is then coating some of the areas where we're seeing cartilage fibrillation or fraying of the cartilage, unevenness, to try and make it more of a smoother thing. I know here it's advertised in the human world as, is putting a shock absorber back into your knees or putting a lining back into your knees. It's not quite like that. We wish it was. But these are polyacrylamide gels are certainly things that have their place. They're awfully simple to use because they're just inside a syringe, inside a box that sits inside the vet clinic or the vet truck, and then injected into the joint as an alternate to steroids and an alternate to the biologic-derived joint injections. Yeah,
I'm sure listeners, people have heard of it. It's pretty popular at the moment. People are reporting nice results into various joints. I kind of go back to the published data on it. The initial paper was in significantly arthritic joints in
end-stage joints, knees and fetlocks.
Yeah, knees and fetlocks, end-stage joints, and they showed a reduction in the lameness score, not an absence of lameness, but a significant reduction in the lameness score. So we know that it must be pain modifying, and the belief also from the studies is that it is disease modifying in that they can make the synovium look happier, and hopefully make it a little bit more elastic. I personally use it unfortunately, there are horses with quite bad arthritis in joints, particularly ones where that range of motion is reduced. So, for example, in fetlocks or knees, and have seen an improvement in range of motion in those joints afterwards, where I think it probably has helped the joint motion. Equally, goes hand in hand with some targeted physiotherapy, maybe some water treadmill exercise, and all the other things that go hand in hand. So how do we know which bit's most effective? But I definitely feel as though it definitely has a place. So cool. That's a lot. There's a lot of cool things we can put in joints, isn't there? Which ones do we put in?
Yeah, exactly. There's no right or wrong way. Each individual horse has to be assessed on an individual level, and then also the owners and riders' individual risk assessment, budgets, veterinarians' preferences, veterinarians' access to products. All of those come into the decision-making process in terms of what you actually inject inside the joint. Yeah.
I think the other thing that we haven't even quite touched on is things like medication withdrawals. So one of the the things
really important.
Really important to be aware. Anyone here with horses that are competing, you always want to know what's going in your horse and how long, what that medication withdrawal is. So
And
again, with the biologics, there isn't any, because you're not putting anything in there that's testable, albeit you probably have the horse sedated to do the job. So that will have a withdrawal. Something that we're probably more aware of over here. I know you compete under FEI regs in America as well, but Chris and I were talking off air before we started, but the regulations in America are very different to what we're used to over here, aren't they?
Yeah. So FEI is one rule everywhere. Just a quick reminder that you have to be drug-free at the horse inspection, not when you compete. At the horse inspection, drug-free. I tell you what, you come compete here in Wellington, you're getting drug tested out of the trot up. Happens. But in terms of the United States Equestrian Federation rules, the medication rules here are very much more permissive than what most of the world is. So, for example, you're allowed to compete on phenylbutazone. You can give bute 12 hours before you compete. You can compete on a large different variety of anti-inflammatory medications, and then a variety of other types of drugs with different types of much shorter withdrawal times than what we would be used to in the FEI world. So it's a brave new world. Well, it's not brave. It's not new. It's just a very different world here in the United States in terms of competing national rules, where the drug rules are very permissive.
And I think that what I wanted to just sort of probably end on is just maybe a little bit of a discussion between the two of us about probably sort of different cultural approaches to joint injections. I mean, as much as I pretend I'm old, but I'm, whatever, how long I've been doing this as a veterinary now would be what I qualified in 2006. So maybe not quite 20 years.
18. That's pretty solid.
And it's definitely evolved, and I think,
very much so.
10 or 15, maybe 15 years ago, the concept of, let's say, doing some routine hock medications seemed relatively alien to a lot of people who were sort of who had horses. And sometimes, to be fair, often having the discussion with owners who might be a generation different from the riders as well. So to where we are now, where I think we've already discussed that sort of injury prevention, prehabilitation, managing low-grade problems to try and prevent more serious problems. But Chris, why don't you? I mean, it's different. It's different in America with they have as you say, a bit. They may be just a little bit more interventionary with their medications than we would be over here.
I think in terms of my understanding of the veterinary culture here in relation to joint injections and medication in general can be reflected a little bit in the wider human culture in terms of approach to medicine. So, for example, television advertisements advertising prescription-only medications, radio advertisements that are advertising prescription-only medications. You have this product, you need Resolven, it's going to fix your mild to moderate, blah, 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 whatever it is. That's illegal in almost every other country in the entire world to be advertising medicines direct to consumers. The veterinary market here, completely, totally fine to advertise prescription-only medications direct to consumers. Online pharmacies direct to consumers. Veterinary pharmacies that are at the horse show, giant semi-trailers of veterinary pharmacies with in-house vets who are prescribing medication directly to clients. So the ready access to medication in humans as well as horses is a very different culture than that is in Europe, Australia, and the United Kingdom, Ireland, New Zealand. It's a different concept towards healthcare. Healthcare personally here is a very expensive concept, and you get inverted commas better healthcare if you pay more money. There isn't an NHS, there isn't Medicare in Australia, that public healthcare system. So the concept towards spending money and being and doing a lot of medicine for humans is normal. And so then that is similar in terms of our equine athletes. And so the concept of multiple joint injections at the same time, or multiple injections at much shorter frequency is a very different concept here in America than it is in the United Kingdom and Europe. Not that one is right or wrong; it is just different.
Definitely. I mean, listeners, we're not trying to say they're right or wrong, but I think it's just interesting to discuss the differences between different countries.
Very different, very different. And so, just different concepts, different approaches, different veterinary cultures as well, in terms of the way veterinarians earn their money, the way they make their income, and also the debt that's associated with going to university here in the United States. It's not uncommon that my baby veterinarians that are working for me have $200,000 worth of debt that they need to pay off just from going to veterinary school. It's a very different world than the veterinary system that I went through, and very different world than the veterinary system that is present in the United Kingdom and in Europe, where, if you're talented enough and you get selected, you probably get veterinary school for free.
I wouldn't say that is quite the case now. I think there's still significant debts coming out, but I think it's tough talking about money, isn't it? Like, vets don't like talking about money. But things do have a cost, and these young people who've spent 5-6 years at university in America, often more because it's a postgraduate degree. There's a lot of stress on these guys coming out with the loans that they've got in place. But I think it is interesting, isn't it? Maybe a little bit more interventionary approach. As I say, we do, we treat plenty of joints in this country, and I think that approach at a higher level sport is definitely there, and that's the case. But equally, I don't want listeners thinking that every horse needs to have their joints injected. Some of the soundest 5-star horses I've ever known never got touched. Every horse is different, but I think it still doesn't step away from that concept of knowing horses well.
Yes, and sometimes
rest regularly,
and sometimes rest is all they need. Sometimes they need an off season, and sometimes they need diagnostics to know exactly what part of that joint we're really trying to help. An interesting example I have, it's in racing, but back when I worked in Australia, we had a big racing ownership group, and they the culture between Sydney racing and Melbourne racing in terms of veterinary at times is different. And he compared his veterinary bills. He had similar veterinary bills between Sydney and Melbourne. I was working in Sydney. He had similar race results in terms of his wins per run and his income, but his veterinary bill was cheaper in Sydney and had the majority of his veterinary bill in diagnostics as opposed to treatments, whereas down in Melbourne he had a slightly higher bill on average, and the vast majority of his veterinary treatment, his veterinary bill down there was treatments, not necessarily diagnostics. So I always have that in the back of my mind, that the same results came from one attitude that was more diagnostic approach and one attitude that was more treatment approached.
That's interesting. Really interesting. And and I think that just completes the loop quite nicely, going back and, what we said at the beginning about getting as close to or getting as an accurate a diagnosis as possible means that you can be really targeted with your treatment. So, Chris, that's brilliant. Me and you could just chat forever, but we've been going for more than an hour. Listeners, I hope it's been really valuable. There's been some geeky things in there, but also, I'm pleased to get stuck into a good veterinary topic. I hope people find it useful. I hope it gives some perspective. Get out on the social channels and ask questions. Ask questions of your own vets, of the guys that are, we love it. We like questions. We like to discuss these things. It's interesting stuff. And when you start running into problems with your horses, hopefully you'll a bit more awareness of the different options that are out there, because there are lots, and that means that we are hopefully as an industry in a position to try and help as many horses as possible to make sure that those horses can keep doing what they love doing, and that's training and competing. So Chris, thank you very much. thank you for coming on.
Thanks for having me. It's
I hope
really
you get
a pleasure.
I hope you get your eventing fix and you're not stuck just having to look at show jumpers and dressage horses.
No, I'm very lucky. I am again invited to work at Defender Kentucky Horse Trials, which is cool. It's a special place. I get to base myself in Lexington for quite a bit of the summer. But yeah, working at Kentucky Horse Trials is super cool.
Well, that makes me very jealous. It's still on my bucket list. I've still not made it.
It's magic. We need to collect all the 5-stars, mate. Let's go to all of them. It'd be really fun.
Need to rack that up.
Yeah, and I'm just going to throw it out there. I don't know anyone who's going to listen to me, but I think we need a Defender Grand Slam, a Defender Burley, a Defender Kentucky, and then a Defender Blair. Win all those 3 in a row. Imagine that. Win Blair, win.
That'd be some event horse that could do that.
That'd be one hell of an event horse. Win Blair, win Burley, win Kentucky. Now that is a Grand Slam I want to see.
Well, there you go. There we go. So any prospective listeners from Jaguar Land Rover, please do speak to your bosses at higher levels. Let's make that happen. That'd be amazing. Yeah. And if they fancy sponsoring the whole box, it could be the Defender whole box as well if they like it.
The Defender box. Hey, there's little boxes on the side of their cool new Defender.
Yeah, they are. They are cool. They are cool.
The Defender box.
Right. Chris, awesome job. Thank you ever so much.
Later, mate.
Listeners, hope you all enjoyed it. And we'll be coming back to you soon with another episode of the Defender Whole Box.